Thank you so much for taking some time out of your day to attend our meeting. Today we want to I want to share a little bit about American Accreditation Association, the healthcare part, and how you could possibly work with our team and become a consultant with us and what that entails. So very excited to go over this information. And as Dima said, the chat is there. We're going to have a time at the end of the meeting to go through the questions. And if I don't get to all of them, we will post the answers later. And we also are recording it. So that is great information on that. So thank you so much on that. Come on, there we go. So yeah, so as I said, I'm going to review who we are as American Accreditation Association, fondly called AAA. Then I'm going to go a little bit into the healthcare accreditation part, which I'm very proud of. Overview of why accreditation is important, and then what is the role of a AAA consultant, and then what it is not. And we'll review some of the key standards and then share with you how you can get started to become a AAA consultant. And as I said, the question and answer piece on that. So about American Accreditation Association, we're internationally recognized. Yay! We are a U.S. government provided organization, and we provide services and accreditation worldwide, which is very exciting. And so the main office in the US is in Virginia, and we do have international operations as well over in London. I should share that lovely map. I don't know how big you can see it on your screen, but we are operating in 52 countries, which is very exciting. And we have a wide range of services that we will share with you shortly. But really our goal as AAA is to provide international accreditation so we can inspire confidence in the quality of the products, services, and accepted of results in accredited organizations, and the protection of health, safety, and environment of the public. We want to promote the acceptance of the accredited results and certificates internationally amongst global partners. And we continue to strengthen our operations, developing capacity and capability to exceed the expectations of our customers and stakeholders and deliver accreditation services to the highest quality and technical standards. And I'm going to add on here that one of the great strategic objectives that we also have is that because we are in 52 different countries, that we have an understanding of the different capabilities based on country regulations, resources, and we work with the organizations so that they can help achieve the accreditations based on that information. So these are the services that we provide at AAA. Of course, I put the healthcare accreditation up there on top, and we are internationally ESQA standards, completing that and recognized by them. We have school accreditation through the Department of Education standards, laboratories accreditation with the ISO IEC 17025, ISO 15189, ISO, and IEC 17043. Oh, that's a mouthful. We also have training and education providers, criteria for institution and programs on that. And it's, if you can, check out our LinkedIn page for American Accreditation Association and see some of the places that have recently got their accreditations. And I think it will surprise you the various types of training and education providers we work with. And we also provide accreditation for inspection bodies through the ISO IEC 17020, and then certification body accreditations as well. So our values are excellence. We want to promote quality. Sorry, get sidetracked in somebody's chat. So we have excellence, promoting quality. We want to be at the highest standard possible. Innovation. We're always looking at ways that we can become better. Our transparency, we're very open with what we're doing, why we're doing things while we're working with people, what is happening. Professionalism as well. It is, all of our accreditations are truly accreditations. I recently went to a site, and one of the people that I got to interview was very surprised at how in depth we were asking questions, and that it wasn't just a come and look see visit and give a certification of accreditation. So we hold that professionalism and integrity very closely. And leadership, we want to be leaders in the world of accreditation in all areas of accreditation. So the healthcare accreditation, we are providing outstanding, our goal is to help others provide outstanding patient care. We feel that that is highly valued both for the patients as well as the organizations and the communities. We want to work with medical establishments and providers that are dedicated to providing high quality care, and have the American Accreditation Association healthcare accreditation and certificate that they receive have great meaning to them on that. The nice thing about our healthcare accreditation, it is wide range. So we can work with individuals in hospitals, dialysis, day surgery, private clinics, polyclinics, dental treatment, ophthalmology, community pharmacy, and medical tourism, aka medical travel as well. So we're very excited about that on that piece, and want to let you know that we bring a depth of experience, and we pride ourselves at being a member of international organization ESQA that has 30 years history of promoting and improving healthcare quality and safety. They're in 70 countries, so we have a few more countries to go to before we can hit that 70 number on there. But the standards in the healthcare accreditation were developed by a team of respected professionals and experts to ensure that the organizations that are seeking accreditation meet the highest health and social care requirements, allowing us to create greater trust and respect in the communities for the organizations getting accredited. It lends to the trust and the quality of care that it's being provided. So helps them with their community partnerships, looking outlooks. Keep an eye out. In a couple of months, I'll be doing a webinar on the return on investment of healthcare accreditation that will go in more detail, both financially as well as in the communities there. So what is healthcare accreditation? So healthcare accreditation is a formal recognition of all the hard work that the organizations and healthcare providers are doing. The focus is on quality and safety, and we encourage best practice and evidence-based practices when it's possible to do that in the organization. We also look at the clinical governance of the organization to make sure that there is a clinical voice being heard, since it is healthcare, and regulatory compliance, how you're complying with, how the organizations are complying with the local regulatory areas, and that the accreditation continues to drive for continuous improvement. Healthcare is ever changing, so we are always looking at how can we do things better, and how can we do it realistically better, and sharing that information with you. We get lessons learned on all of our site visits, and as a consultant, you can contribute to those lessons learned. So why does it matter? So I've touched on this a little bit earlier, but a big part is the trust and credibility. If you achieve accreditation, the healthcare organization achieves the accreditation, it promotes the trust and credibility for their patients and being referred services. Patient safety is another piece that it indicates that the healthcare providers putting patient safety first, that there is an operational efficiency that clinical is involved as well as the operational piece. Care quality is looked at, and that is not an organization and just asking for funds and money, but they are doing what is right. Accreditation also helps with enhancing opportunities, and that could be funding opportunities, partnering opportunities, and just growing. And it's often required. So that's a big piece there too, but we don't have, as you notice, I put that down in the bottom of the corner because it's required, that's great, but everything else, the patient safety, care quality, are what's really most important about healthcare accreditation. So this is just a little bit more on the healthcare accreditation that we've done, and a reminder, we've done ESQA, so international recognition is part of us. So in the healthcare, AAA's healthcare accreditation area, we do the accreditation surveys. So healthcare providers can get accredited, but we also have consultation services where we have consultants that work with healthcare providers to ensure that they are meeting the standards, helping them understand what the standards are and how they can implement them in their region and in their practice on that. The consultation services also includes some consultants bring hospitals and organizations to AAA in effort to seek out accreditation as well. So consultation services is not just you providing services, but you may be already working with somebody that's interested in accreditation, and you introduce them to AAA and help them through that. But we're going to get in a lot more detail about the consultation services in a bit. And on here I have concierge as well, because it's one of the things I pride ourselves in as an accreditation organization that's different than others, is that we are truly working with and being very dedicated and purposeful with the healthcare organizations to help them through the process, help them with any questions that they have and guidance that they have so that they have a successful experience through the accreditation process and receive accreditation at the end. So rather than referring them, all of our information's in our guidebook or on the website, each hospital will have a point person that they can speak with and get guidance from, or just ask questions of clarification to help them through the process. And we are in constant communication with them on that. And also with AAA healthcare accreditation, we are growing. And that's why we are hosting this webinar today, in hopes that we can identify some individuals that would like to work with us as consultants. There is a demand. We are getting many inquiries about becoming accredited all around the globe on that. So it's a very exciting time, but on the same hand, we don't want healthcare providers, hospitals to have to wait. We want to be able to serve them immediately and meet their needs, because the healthcare accreditation is a process where they submit information, we review the information, and then when we do site interviews, and we have healthcare committees as well on that. So the demand is there, and that's why we're seeking your input as well as possibly a partnership. So, I should know my slides a little bit better, but the accreditation process here, preparation, we typically tell folks that it takes anywhere from 3 to 9 months to prepare, because there's writing policies and procedures, putting those policies, procedures, and systems in place, and being able to demonstrate that. There's a document review where we ask that all those policies, procedures that are pertaining to the level of accreditation that they're seeking is uploaded, and we take anywhere from 3 to 5 weeks. We're trying to take two to 3 weeks to review all those policies, procedures, so then we can ask questions, get clarification, so we have a clear understanding of the processes and kind of the overview of the healthcare system that we're going to be reviewing. And then we have our survey, and the survey could be anywhere from 1 to 3 to 5 days. We have multiple surveyors that work with the organizations depending on the specialties as well. And here we're seeing the physical layout, meeting the staff, meeting the clinical, meeting the operations, comparing with what they are doing with what they're saying that they're doing, saying on the policies and procedures that they're doing. This is where I get a lot of my lessons learned. Just came back from a survey and have some great things to share with my other surveyors and with the healthcare fields on how someone is approaching some things. And then following the survey, we write, team lead compiles a report, and we meet with an accreditation committee, again, specialist on there to ensure that it is being evaluated by someone in that field. And that decision can take 2 to 3 weeks. And then we can make our final determination of full accreditation, partial accreditation, where they might have some corrective actions to do. And as a consultant, you would be able to help them create those corrective actions and put them in place. And once that's reviewed. And full accreditation is for 3 years. And we ask for updates at the half point mark to see how they're doing. But we inform our healthcare organizations that we are here the entire time. If they have questions, they have changes, they need to just understand how something might impact, they can always contact us. Again, going back to that concierge type of service on that. So I pride my healthcare team as being efficient, effective, and impactful. We do have a formalized process. We have systems in place for our consultants, and we're expanding on our guidebook for our consultants and adding information there, also for our surveyors, and creating items for our healthcare providers that are going through accreditation as well as have gone through accreditation on there. We've got those guidelines. We're providing helpful documentation to streamline accreditation, both from consultants, if you're talking to an organization about becoming accredited, to the healthcare partner themselves of what they need to do, checklists, various formats, depending on how they like to work, to streamline that, and for our surveyors as well. And we have a robust library of resources and tools to be able to access on there. So I want to give you a little idea about the surveyor role before we get to the consultant. So the surveyor role, we review documents, we provide the interviews on there, we give initial feedback. It's not formal feedback in that aspect, but we give initial feedback, both positive and some options of how they might want to change things. So you might want to say it's a little bit of coaching during the survey process on there. The site survey, we go really into depth asking questions. We do not approach it as a gotcha to try and find fault. We try and find opportunities that they may need to tighten up, or there's discrepancies between their policy and their actions. And we offer suggestions on that, but we are not there to make anyone feel bad. But we are there to promote the patient safety that they're doing, or some things that they need to take a look at on that. We also observe the interactions, which is sometimes hard to do because as soon as a stranger walks in on the site view, that changes the dynamic, but we are there. We're also there to offer support so providers can continue to ask questions even during the site survey, and we can give support and options of that. And we're the face of AAA when we're at the site. So the consultant role, the whole reason you're here, right? So this is an exciting opportunity, and it's really a crucial aspect of the accreditation process, and I want to provide clarity on the role entails and what it doesn't entail on here. So AAA consultant is a knowledgeable professional with expertise in healthcare, quality, safety, and accreditation standards. I understand you don't know what our standards say at this time, but we do an in-depth training on our standards to ensure that you have full knowledge and awareness of what they say, as well as that concierge feel that applies to the consultants too. We're here for the consultants to help you on that. The consultants are also an advisor, educator, guiding healthcare organizations through the accreditation process. May even be educator of why they need accreditation, what is the benefits of that, why do they need that? If they're the only hospital in town, why do they need that? What it can lend to them on that. Consultants also conduct readiness assessments, also often called mock surveys, to help organization identify areas for improvement. Consultants can also provide training and education to staff on accreditation standards and best practice. And that's a big part of it. I will also say that training and education piece is the consultants help alleviate any anxiety or nervousness that someone may have about going through accreditation. It's a little terrifying to have strangers come in and look at all your information, but the consultant helps bridge that and makes it a less fearful experience, which makes it a better experience all the way around, both for the healthcare provider and the surveyor. The consultant assists organizations in developing and implementing policies and procedures to meet the accreditation requirements. And consultants are a valuable resource for organizations seeking to achieve and maintain accreditation. So that's another beauty of being a consultant. It could be, but it doesn't necessarily need to be a one-time event. Accreditation is ongoing. So you help them achieve their initial full accreditation. Well, they should be continuing to work on the standards and meeting those standards throughout the entire time that they're accredited. And then when they need to renew their accreditation, you can still be part of their team and process if you and the healthcare organization choose. So it could be a long-term relationship for sure. And our consultants bring a wealth of expertise and experience to the table and partners in the accreditation journey, helping organizations build a sustainable culture of quality and safety. And the consultants also help us at AAA build a quality and robust depth of information and resources that we have. And we have conversations, met with some surveyors, had conversations about how the site was different than what they normally seen, and determining, what they could do, what was realistic with some of the restrictions that they had implemented on them as well. So it's a wonderful opportunity to meet people all around the world on that. On that part. So now I'm going to get to what it's not. The consultant is not so you would be an independent contractor. So you're not an employee of AAA, but work very closely with us, and you feel as part of the team. Consultants don't guarantee accreditation either, so it's still up to the facility based on findings of the survey on that. The consultant may or may not also be a surveyor, but you would not provide the survey for the same organization that you're consulting with. So we do have that barrier. You can provide a survey for organizations that you don't have a relationship with and you haven't done any consulting with. But if you're consulting with Hospital A, you're not going to do Hospital A's survey on that either. So consultant, it's not all about you writing the policies and procedure. It's you teaching we understand sometimes that's the initial part, but educating the healthcare provider as well of how do you write the policies and procedures? What are the impacts? Guiding them, building them to a more sustainable future. We, as consultants, we do not give out any legal advice either on that. And one big item that was brought to my attention, in many regions of the world, consultant means that the person is a physician or doctor providing services at a different level of care within the organization. And that is not what this consultant is. This consultant is a advisor and coach helping them through, but you are not, it is not, becoming a AAA consultant is not us giving you a certificate that will allow you to perform medical services or medical care at a different standard than others. I hope I'm clear on that, because that was something that came up on a previous webinar. Folks thought that they attend a webinar, they became a consultant, and then they could tell their hospital that they're now at a higher level on that. So that's not what we're doing here on that piece. So the key accreditation standards, I keep talking about ESQA. So ESQA evaluated us to see if our standards were meeting expectations, meeting the needs for international accreditation, and the focus was patient-centered and organization-centered. So that is a big part of what we do. So with patient-centered, and these are the actual standard titles, we've got privacy, rights, and responsibilities. So making sure that patients are aware of what's going on, access, assessment, and continuity of care, looking at how patients attain services, what are we doing to determine what services need to be done, what happens after the services are done for continuing care, the provisions of care, medication management and use, very important piece there. If applicable, the surgical and anesthesia care, and diagnostic services and procedures. So while many of these apply to all levels of care in healthcare, there are some that don't. So in my outpatient clinic, if I'm a primary care physician and I'm not doing any surgical or anesthesia care, those standards wouldn't apply to us. So we wouldn't be measured against that. So there's no need to do policies and processes on those parts. But everything on this screen is about how the patient is being cared for, that they're being educated, that they're understanding of what is happening, why it is happening, and that they or their loved one who's in charge of their care are fully aware of this to promote this patient safety and quality of care on that. The organization center portions of our standards are corporate governance and leadership, quality improvement and sustainability, staff planning and continuous performance, health records and information, infection control and hand hygiene, and facility safety and physical environment. Any of you, and I've seen a couple of folks are doctors, so I'm like, they're probably rolling their eyes going, this is not exciting part. But when we look at healthcare accreditation, we have to look at the entire process and the entire system, from who's leading, who's making the final decisions, big important part. Are there some clinical people involved in that? The quality improvement and sustainability. While data might not be everyone's favorite, it's important to see what is working, what's not working, how they can continue to help their communities and help their patients on that. So that is why when we have surveyors, we often have a mix of clinical and individuals who are more on the administrative part to look at the areas and portions that are very specific to them. So that's an overview of our actual standards on that. Very brief. When we have our consulting training, it is 3 days long, and the training on the standards is the majority of that training. And we go into depth about what we're looking for, what are some ways that it could be presented, and sharing how it might be presented in different areas of the world. It's very fascinating training, I must say. So as I mentioned, we're expanding, we're growing. So we need more surveyors and we need more consultants. And with that, we're also looking at expanding individuals to provide trainings, and as well as to help us, excuse me, provide trainings because there's been a demand for some further education. A big one was on quality, so I reached out to one of my quality individuals. Recently met a person that was very involved in infection control. We discussed about possibly what webinar could they do as well to help us, which in end would help you as a consultant if you're doing those trainings, getting your name out there and your knowledge and awareness. So we're growing. It's exciting. It's terrifying because it's happening so fast, but it's a good thing. So being a consultant, some of the benefits, first benefit, you get to contribute to the healthcare quality and safety. Yay! You work with a diverse healthcare organizations and professionals as a consultant, which is also very exciting. Being a consultant doesn't mean that you can only work in your backyard kind of thing, or in the only communities that you know. That might be the easiest place to start, but as you continue to grow, possibly help us with some trainings and webinars, get your name out there, you'll become in demand. Being a consultant is also a very rewarding and flexible career if you like to help people achieve goals and improve systems and work with others. This is definitely a wonderful opportunity there. The benefits is the resources that we have at AAA, as well as the trainings that we offer our consultants directly, as well as trainings that we have available that we can offer to other healthcare providers, and the support that we will provide to you as a consultant. And the benefit is expanding your network and enhancing your expertise. Yay! So now I know all of you want to become a consultant with AAA. So what's the first thing to do is will be to notify me that of your interest. I will share my contact information, both my email as well as my WhatsApp information. So if you could just drop me a brief email about that you're interested, if you can include your resume or vitae and the areas that you're in. Then I will send you a link to an official kind of like an application form, just getting a little bit more information about you. We do like to know what your specialties are, if there's any specific specialties, any languages that you also speak, if there's any conflict of interest. So if you're also working with another organization and let's say you work with them in the UK, well, we won't, then we can still work with you because as I said, we've 52 countries, but you just won't be a consultant with any of those that are already in the UK. That could be a conflict of interest with your other company on that. So you'll fill out that form. Once we get that information, we'll do a brief little interview, you and I, and you get accepted, then you attend a proof training. And as I mentioned, that training is 3 days. And we understand it's hard to get 3 days off to do a training. So if you need to miss part of a training, we do record those. And I will tell you there's an exam after the course. So that's a big part of that. And then we identify relationships with hospitals, clinics, healthcare networks within your approved area, region, specialty kind of thing. If you already have those relationships, great. If not, where do you want to work? We work on that together. And then we start partnering with AAA for consulting projects. Yay! It's very exciting, very thrilling on that part. And I think it's a pretty simple process. And the training is pretty intense, but it's a lot of information. You get to go over the standards. You also get to look at how is the scoring done, so you completely understand that. We go into quite a detail on that piece. So how we support the consultants. So, I mentioned the training. I keep mentioning that training. So we have that formalized training. Wonderful thing is it is recorded, so you can reference it later. We do webinars for consultants as well as your customers. We can provide you with direct referrals. So if you're in a certain part of the world and we got a referral from a inquiry from a hospital and they're unsure if they're ready or not, we talk to them about our consulting services, and if they say they want a consultant, we can match them up with a consultant in their area and area of specialties. Our resources seem to grow daily. And we have a library just for the consultants as well as for the surveyors. We have mentoring as well to help you through the process of steps that need to happen on that. So we are there for you the entire way. And again, our services are more concierge. We want to help you succeed, because helping you succeed gets AAA to succeed, and that means that healthcare entities are becoming accredited, and that's promoting the patient safety and quality of their care. So as I mentioned, next steps, drop me an email or WhatsApp. Then we have our interview. Our next training is in May. So if it's
Yes,
something that you're,
can I
yes,
interfere here a little bit?
because I was stressing on the days there. Yes.
Yes, so in May, we have an interesting event in May. Give me just 1 second for sharing my screen. Is it clear now, Wendy, please?
Mhm.
Yeah,
Are you sharing your, oh, you want me
yes.
to stop sharing mine? I know. Let's see. Stop. There we go.
Mine is available right now?
I don't see it. No.
1 second, please. I will stop sharing. I will share one more time.
No, apologize if anybody hears my cat
Mm,
screaming in the background. There it
yeah.
is.
All right, now it's perfect. So, regarding talking about May, yes, we have an interesting event, which is Approved Consultants for Healthcare Accreditation. So, it will be online as well. And here are the fees for this. And here's just an introduction about it. And I'll give just a quick brief about it, and then I'll convey to you, Wendy. Here we have the key learning outcomes. Here we have the laboratory accuracy and reliability. We have the standards and requirements. We have the accreditation procedures. Also, we have also definitely the surveyors and what's the role of the consultant going to be in the accreditation department. Also, we will talk about conducting a gap analysis, the quality improvement plans, the workshop and case studies, and assessment, and we'll end up with certification. Because many of you have asked me about the certificate for the webinars. So no, the certification will be provided at the end of the succession of the training courses. And here will be my favorite speakers, Wendy Denicourt and Shakti Nirbar. And here is the certificate. Will look so like this, a professional provided from AAA. And what the course will highlight and who suits him or her this course and why would you choose this course. And here you can get started today, you can submit your inquiry and get to the whole simple procedures. So for all of you, I will share this link, this landing page for everyone who's interested in becoming an approved consultants for us and would like to join this training course. And yes, this is a brief about this. Wendy, what would you like to add?
Yeah. So no, thank you so much for that information. That was very, very helpful. As you can see, like I mentioned, the training course is pretty intense. A lot of information. You will be tired after every day, but it's great information that we'll have there. So I'm going to share my screen again so you can have my contact information. And there it is. All right. So, oh, no, go back. Come on. So there's my contact information on how to reach out to me. Wendy at AAA-accreditation.org is my email or my WhatsApp. I'm in the US, sunny Florida right now. So drop me some information I saw in the chat when Dima was talking. I was trying to go through all the chat information there. Saw that some of you were very interested in that. So please make sure you reach out to me and send me your resume or vitae so that we can start the process and get you to fill out the form. We can meet one-on-one through video and start your journey on that. So I do want also, in reviewing the chat, I do want to just make sure that it's understood that this consultation is to be a consultant for AAA and helping healthcare organizations become accredited. We're not authorizing or awarding consultation level certificates for you to become a higher level of a provider, physician, or whatnot on that. Now, I will say, I mentioned what is needed to become a AAA healthcare consultant, and that's knowledge of healthcare. It does not necessarily mean that you need to be a physician or a nurse, or a dentist, a hygienist, or any of that. It's your awareness and knowledge of that piece of information. So if you're not a doctor and you still want to become a consultant, please reach out. If you are a doctor, that's great, and you want to become a consultant, please reach out. But just know that this certificate for to become a consultant with us is to be with AAA, and that we, as that consultant, you are helping other healthcare organizations achieve healthcare standards on that piece. So very excited, very happy. Thank you so much for all the questions. So again, the requirements for a healthcare consultant with AAA is you have some healthcare experience, you have a desire for patient safety and quality of healthcare on that, and you send me an email or a WhatsApp.